In the United States, multiple subsystems within the healthcare system itself have evolved in order to facilitate the delivery of healthcare services. These subsystems developed either through market forces guided by the law of supply and demand, or through government interventions, or even through the private sector, with nonprofit groups, for instance, seeing a gap where there is no healthcare service being provided. So, for instance, private health insurance started because there was a market for such services when employers started providing benefits by buying health insurance for their employees. Or also, there's a market for it for individuals who have the money to buy their own health insurance. Now, private nonprofit corporations or private nonprofit organizations, for instance, have set up some subsystems within the public health domain, such as um, uh, Planned Parenthood, for instance, to meet healthcare needs in rural areas and also to meet reproductive health services needed in certain areas where this is not readily available. Government actions have created subsystems to cover people who belong to certain groups, like the military, some government employees, Native Americans. So there is what we call the Indian Health Service, for instance, the elderly. So we have Medicare, and then we have the vulnerable populations for the poor. An example would be Medicaid. So to be able to access healthcare services in the US, you must either fit in one or more of these following categories. I mean, you could fit in more than one, of course. The first subsystem we're going to talk about is managed care. Managed care covers most Americans in the private and also public health insurance. So this happens when Medicaid, for instance, contracts out with Health First or other insurance companies to provide managed care Medicaid. The managed care organization contracts with selected healthcare providers to deliver healthcare services to its enrollees. So, for instance, certain health insurance companies contract out with Montefiore, and those who have that type of insurance can go to Montefiore because the insurance will pay Montefiore for those services. Managed care is the most dominant healthcare delivery system in the United States, and it assumes the role of insurer to manage utilization and the cost of healthcare services. I am not going to dwell too much on this because we're actually going to discuss this in a separate session for healthcare financing, but managed care utilizes two types of financing mechanisms, and the first is capitation. Capitation literally means per head. So providers of care receive a fixed payment from the health insurer for each covered enrollee or plan member. So it's a per member per month. So for instance, if I am a clinic and I accept a managed care plan and say HIP or Blue Cross Blue Shield, if the arrangement is capitation, I will receive, say, a certain amount for each person I cover or provide services for. And the amount of services that I provide to that person better be paid by that monthly fee I get. So otherwise, I will lose money because I might provide services that is worth more the capitation fee. The second type of financing mechanism is what we call the discounted fee arrangement. So managed care organizations, the insurance companies contracts out with selected healthcare providers to discount services for enrollees. So these are for people, for instance, that have insurance coverage or health plans that contracted out with healthcare providers. For instance, again, I'm going to use the example of Montefiore. If this is the case for discounted fee arrangement, Montefiore agrees to receive a discounted fee for every service that Montefiore provides to the enrollee, the plan member for that health insurance company. So for instance, if Montefiore charges, I don't know, $200 per visit, because they have agreed for a discounted fee arrangement, the health insurance might just pay them $100 for each visit. But in return, you are sort of assured of patients because the insurance companies have thousands of plan members within their health plans. The next subsystem we're going to talk about is sponsored by the federal government through the Department of Defense. The military medical care system, that's what we're referring to at this point. And the military medical care system's health services is available free of charge to three groups of people. So first would be the active duty military personnel, all branches of the military, and their dependents. And then the next category that is covered by the military are certain government employees, uniformed non-military government employees, like the U.S. Public Health Service. So if you're familiar with the United States Surgeon General, whenever he appears in public on an official capacity, he's wearing a Navy uniform. You've probably seen him show up in the coronavirus briefing a few months ago when the White House was regularly doing that type of briefing for the public. And the second group of government employees are those that are uniform but non-military, are those that are employed by the National Oceanographic and Atmospheric Association, or NOAA. So these are like the Weather Bureau guys. It is financed by the military and covers families and dependents. So the next category would be for retired military veterans. So we'll talk about that in a little bit more detail in the next slide. But the military medical care system is well organized. It is actually found all over the world, wherein, we have military bases all over the world. You have, this system present in those military bases to provide healthcare services to active duty members who are based in those military facilities overseas. It is highly integrated. It is very comprehensive, such as that it covers preventive care. And on top of that, of course, acute care, hospitalizations, and other healthcare services. So there are two organizations within the military medical care system. The first is called TRICARE, and TRICARE is, of course, financed by the military, and it covers families, dependents of these active duty military personnel, and then the dependents, and then also I told you about those government employees that are considered uniformed personnel but non-military, such as the U.S. Public Health Service. Now, TRICARE also covers retired military, but that privilege is only given to those people that have served in an active duty capacity straight for 20 years. So if you've made the military your profession and you've continuously served in an active duty capacity for 20 years, you will be entitled to TRICARE after you retire. The second organization within the medical care system is called the Veterans Affairs Healthcare System. This is available to retired veterans. It is focused on disability benefits. So it's really more for retired military that had certain disabilities while serving on active duty in the military. So you could have TRICARE actually, but you could also be entitled to VA if you have certain disabilities, and you could also go to VA facilities for that. So this covers hospital, mental health, and even long-term care. It is one of the oldest and the largest. It was organized in 1946, right after World War II. And it is, again, compared to other healthcare systems, it's one of the biggest in the world. They're organized in geographically distributed what we call service networks. And they're responsible for making sure that access to healthcare for retired military veterans with certain disabilities are equitably and readily available for people that need them. So if you want to learn more about the eligibility on the VA healthcare system, you may want to visit this website. Let's click on that. And there you go. This is the website for that. So you could scroll and you could read up. And this is the basic guide on eligibility for VA healthcare services. So the next subsystem we will be discussing is called the subsystem for special populations, otherwise known as vulnerable populations. And who are these folks? So vulnerable populations are those who are poor and uninsured, certain minority groups such as minorities that do not have access to insurance, also immigrants, some immigrants with certain status, like those who are undocumented and therefore not eligible for public health coverage, public sponsored coverage such as Medicaid. Also those people that live in geographically or economically disadvantaged communities. So for instance, if you live in a very poor community, even if it's in the state, even if it's in the city of New York, you can be considered a part of a vulnerable population. The homeless are also a group of the population that is considered a part of the special population of vulnerable individuals. And also, let us not forget, of course, children who are living in poverty. Healthcare services are provided to these special populations through the nation's safety net. So what is the safety net network of providers? Safety net providers give comprehensive medical and enabling services based on individual needs. So language assistance, transportation, nutrition, health education, social support services, even childcare, on top of the basic healthcare services that they need. The problem is availability of these services vary by community. Not all communities that have a huge population of vulnerable special populations will have this types of safety net providers. And one example are community health centers that we call federally qualified health centers, FQHCs. They provide primary and preventive health services to both rural and urban underserved populations, and they are funded by the federal government through the Bureau of Primary Health Care. So if you could think of an example, a perfect example would be the one down by West Burnside on your way up to campus. When you climb up West Burnside Avenue, to your right, you will see a health center, a community health center, Morris Heights Health Center, and they are actually a federally qualified health center. And the location itself, the community where our college is located has a huge population of people that can be considered part of special populations. So the next subsystem that we're going to talk about, and I'm not going to dwell too much on this because we're actually going to talk about integrated delivery systems when we talk about hospitals. So we do have a dedicated session for this. But integrated systems are networks of healthcare providers and organizations with the aim of delivering a range of coordinated healthcare services to any given population. This particular system would be responsible for the health outcomes of any given population, their health status in that community they're located. And the hallmark for integrated systems would be the coordinated services that are expected to promote cost-effective care and improve the quality of care. So one example, for instance, would be the integrated delivery system of Montefiore. Montefiore actually is composed of several organizations and hospitals. Mount Sinai or Columbia, New York Presbyterian, for instance. These are all integrated delivery systems, and we'll talk more about this when we talk about hospitals, because integrated delivery systems originated from single hospitals, which then grew into independent integrated delivery systems. They're also known as health systems or medical systems. So Northwell is one example also. The Health and Hospitals Corporation of the City of New York, that is one integrated delivery systems. The good thing is, you could be seen in a clinic within that system. And if you actually need to get hospitalized and you go to a hospital within the integrated delivery system, your patient records will be seamless, your care is supposed to be seamless, and the coordination of care would also be favorable because there is continuity of care. The next subsystem I'm going to discuss would be long-term care. Just like integrated systems, we also have a particular session for long-term care. So I'm not going to dwell too much on this, but long-term care, also referred to as LTCs, consists of medical and non-medical care for individuals with chronic health issues and disabilities that prevent them from performing regular daily tasks. So these could also be people that may not necessarily be elderly, but requires rehab services like physical therapy and all that. It includes both healthcare and support services for daily living. Settings can include patients' homes. Long-term care can be provided in patients' homes, assisted living facilities, and also nursing homes. Contrary to popular belief, it's not really completely covered by Medicare. Only the first month of long-term care is covered by Medicare. So we'll talk more a little bit about that. And Medicaid is actually the biggest payer source. Another thing that, that's relevant right now is that there's a lot of baby boomers that are living longer. So we will have a lot of elderly that will require long-term care. But another issue that surfaced was the issue about COVID-19 infections and deaths in long-term care facilities. We have seen that in the news, and it was quite tragic and really heartbreaking. Last but not the least would be the subsystem of public health. We probably don't pay too much attention to this, but if you've been to the health department once or twice to have your children vaccinated, or maybe get some reproductive health care services, this is one of the reasons why the public health system is a subsystem of the U.S. healthcare system, because they do play a very important role in healthcare delivery services. Health departments are funded by local taxes, so the state, county, city. And the problem with this is that local governments that have more money and have higher tax revenues tend to have a more comprehensive amount of services delivered in health departments. So there are healthcare providers employed by health departments, but we also have public safety agencies, human service and charity organizations. I mentioned to you Planned Parenthood, for instance. We have youth development organizations, recreation and arts related organizations. Most of them, if not all of them, are not-for-profit organizations. We also have environmental agencies that do touch on healthcare services. But in terms of the health department and public health, this is what we need to expect from them, or we can expect from them. In particular, on the federal level, for instance, is the Centers for Disease Control and Prevention. So health departments and public health system in itself are responsible for 10 essential services. And I'm not going to read through each of this because you could read it on your own. But this is the mandate, and as you can see, it's a lot. This is the mandate of health departments and healthcare providers that fall under the subsystem of public health.